clean up the spill. Next, we'll move on to hepatitis B vaccination. This is one of the most important things that employees should think about when they are working in a healthcare facility. It's effective in preventing hepatitis B. 95% of people who get the vaccination develop immunity. It's given in a 3-dose vaccination series. It's safe, effective, and long-lasting. And generally, it's good to test for antibodies 1 to 2 months after your 3-dose vaccination series has been completed. Healthcare workers who do not develop an adequate antibody response should be revaccinated. Hepatitis B is a virus that can live outside of the human body for 7 days. So, in a setting such as ours, it's a good idea for all healthcare workers to be vaccinated against hepatitis B. The next vaccination we need to discuss is influenza vaccination. This is offered to all employees annually beginning in October. It's critical that all UBHC employees obtain immunization to prevent the transmission of influenza to high-risk patients, which could cause serious illness or death. We do not use live vaccine, and the immunization cannot cause influenza in a vaccinated person. Influenza vaccination is an important healthcare provider responsibility. We recommend that every single healthcare provider, every single employee at UBHC receive influenza vaccination. Now, if you have a bloodborne pathogens exposure while working at UBHC, make sure that you clean the area with soap and water for 15 seconds. If it's a mucous membrane involved, such as your eye or mouth, flush the area with just plain water. Please don't apply any type of antiseptic or disinfectant. Please don't squeeze the site. There is no evidence of benefit for doing that. Do not use any type of bleach or caustic agent and apply that to the skin. Immediately report this exposure incident to your supervisor. You'll be directed to EOHSI, Occupational Health in Piscataway, or Occupational Medicine in Newark. Your supervisor should facilitate obtaining the source individual's hepatitis B, hepatitis C, and HIV status with the assistance of your site MD or APN. The source individual must give consent for any HIV testing. And the specific procedure for your site must be posted. If an exposure occurs after hours, you will be directed to either Robert Wood Johnson Emergency Room, University Hospital Emergency Room, or in South Jersey, Kennedy Hospital Emergency Room. Employee responsibilities for infection control. All UBHC employees are required to have annual TB testing. You will not be notified when you're due. Please keep a record of your due date. Also, when calling out sick with an infection, you must specify the nature of your illness to your supervisor. This is essential for tracking infection trends at the facility. Please review the infection control policies on the UBHC website regularly for updates. Some important policies that you should be aware of related to infection control. Refrigerators that store patient food, medication, or lab specimens must be clearly marked and temperatures logged daily. Items may not be combined among refrigerators, and any out-of-range temperatures must be explained on the log and corrected. Please monitor patients for any illness. Patients who are ill with either fever greater than 100 degrees, undiagnosed skin rash, vomiting, diarrhea, or night sweats with cough must immediately be excluded until medically cleared. Acute inpatients with any suspicious symptoms must be immediately identified and isolated until diagnosis and/or treatment is established. Any cluster of 3 or more people becoming ill with the same symptoms within a 48-hour period must be reported by the supervisor to infection control at 732-235-4739. If you have toys in offices or waiting areas, These must be cleaned and disinfected at least weekly, sometimes more often depending on the individuals using the toys. This has to be documented on a toy washing log. Patient education regarding respiratory hygiene, cough etiquette, and hand sanitizing should occur at every available opportunity, and signs posted regarding these should be in place at each site. Food safety is another important issue at UBHC. Food must be stored, prepared, and served according to strict food safety guidelines that are all available on the UBHC website under the Infection Control Policy section. Any food prepared at home cannot be brought in and shared with patients. UBHC may only serve food prepared by licensed food establishments to ensure food safety, or food that's prepared under specific regulatory guidelines by the Department of Health. Any unit party food and/or leftover food cannot be left out without refrigeration for more than 2 hours. And the big question about who is responsible for infection control at UBHC, the answer, of course, you are. In summary, please use appropriate engineering controls to limit the risk of accidental exposure. Always apply work practice controls. Wear personal protective equipment that's suitable for the procedure that you are performing. Receive regular immunizations and annual TB testing. Please receive your regular influenza immunization annually. And review infection control policies and procedures as they're updated. And of course, once a year, receive your updated infection control training online. Thank you.